To get started now. Welcome to today's webinar, Introduction to Health, Wellness, and Prevention at Brandeis University. My name is Dvora Pemstein, and I'm the Parent and Family Liaison at Brandeis University. And I am delighted to welcome you and our panelists to what should be a very informative and jam-packed program. We're going to take a look at our agenda, which is, I'll introduce each of our panelists. Then we will go ahead and go through each of their sections and have the Q&A. So let me tell you a little bit about each of them. Diana Denning is the Administrative Director of the Brandeis Health Center. She has been at Brandeis for 6 years and is a key contact for student and family questions and concerns regarding health services. Diana holds expertise in preventive, clinical, and administrative aspects of health and wellness, and is committed to assuring high quality, accessible, and responsive health services to support student health while at Brandeis. Joy von Steiger is the director of the Brandeis Counseling Center. She is a clinical psychologist with over 30 years of clinical experience in the areas of college mental health, inpatient clinical care, emergency care, and outpatient care. She works with a trauma and culturally informed lens. Joy's professional interests include the interplay between culture and identity, trauma, resilience, and what that means for different people from different cultures and circumstances. Sheila McMahon serves as the Director for Sexual Assault Services and Prevention at Brandeis. She is a licensed social work practitioner and researcher in Massachusetts. Her research focuses on primary prevention of sexual assault on college campuses and strategies to improve the implicit curriculum in social work education, particularly for students of diverse backgrounds. So we've got 3 very highly qualified and experienced professionals here to share their expertise with you. And we will just go right ahead and get started with Diana's presentation.
Hi, everybody. I'm so glad to have this opportunity to be speaking with you. Thank you so much for organizing this. So I'm speaking for Brandeis Health Center. We're an accessible, responsive health service. Our purpose is to support Brandeis student health and wellness while students are here on campus. So let's go to the next slide. So our health services are for all Brandeis students, undergraduates, graduates, students with the school health insurance, and students who are using their own insurances. We are open during the school year, Monday through Friday, 9 a.m. to 6 p.m. We have live people answering our phones. We are only closed on Mondays 2 to 3. We always have a meeting, and we're closed on all Brandeis staff holidays. Our primary services, we're your general medical office on campus. We have board certified M.Divs, we have nurse practitioners providing the bulk of the care. Most of this is done by appointment. We have lots of same-day appointments. We can get people in pretty good time. So if you're talking to your students, recommend that they call for an appointment as soon as you're thinking that they should be looked at. The main thing that we do is acute illness and injury care. So we do a lot of sore throats, mono, rashes, gastrointestinal issues, conjunctivitis, twisted ankles, basketball fingers, all of those kinds of things students can come and see us for. The second most common thing we do are immunizations and flu shots. Watch for our flu clinic notifications in the fall. We generally do about 2 or 3 clinics. That will be pretty well advertised and emails will go out. The next most common service we provide are sexual and reproductive health services. So this is making contraception accessible, STI screenings, urinary tract infections, any concerns with menstruation, etc. We do annual physicals here. We'll help students with travel preparation, follow-up from travel, and we also provide a lot of coordination for chronic care. We have a lot of students here who are here with multiple health issues. Sometimes those issues stay in the care of their home-based specialty providers or primary care providers, and we provide ancillary support, flare-up support in coordination with those providers. And other times we actually, with very stable conditions, we may be, managing a lot of it here. We may need to send people out to local specialists as well. We kind of do this on a case-by-case basis. Next slide. Other things that we do, we have a pharmacy service that delivers here to the health center daily. It's Keith's Pharmacy. That information is on our webpage. It just makes it so students don't have to go off campus to pick up meds. We send our prescription meds through them if the student would like to do that. But additionally, other providers, outside providers, can put in their prescriptions to that pharmacy and have them delivered here to the health center for your student. We collect laboratory samples. We work with 3 different labs, LabCorp, Quest, and Boston Clinical Labs, and they can pick up daily here. We can draw labs with orders from outside providers as well and have those results sent to those providers, again, making it easier for students to not have to leave campus. We also provide referrals and linkages for resources and specialists both on and off campus. We do have a pharmacy grade refrigerator and do store people's specialty medicine. Some of these are very, very expensive and need temperature control. They can be sent directly to the health center during our business hours. I advise people to make sure that they're putting the Brandeis Health Center address and mail stop first and request that your delivery service deliver them directly to the health center because we'll be able to maintain that temperature control. Otherwise, they will go to the mail service up on campus and you'll have to be tracking it through them. We also act as a public health intermediary. We're involved with outbreak investigations and interventions, infectious disease reporting. Generally, if anything like this crops up, that is warranting, a community-wide message, parents are included in that community messaging of things that are going on. Next slide. What do you do in an emergency? The health center, while we're open 9 to 6 Monday through Friday, we always have an after-hours clinical consult available for urgent issues that can't wait for the next business day. If something's an emergency, it's already known that somebody needs attention, medical attention now. If they're on campus, they're going to call public safety. They are open 24/7. During the school year, the student-run certified emergency medical technician team also goes out on those emergency medical calls to provide immediate triage and support. It's important for people to know that emergency contacts are accessed from those listed in SAGE. Each student has to list their emergency contacts in SAGE and should keep that updated. Those contacts are only notified on our end if a student is unable to communicate their own wishes and needs. So something that's really dire. Otherwise, a student would be able to contact and make contacts on their own. Let's go to the next slide, because that kind of brings us right into confidentiality. At the health center, your records are kept as FERPA treatment records. These are separate from your school records. Consent, however, will be needed to discuss care if the student is over 18 years of age. So even to discuss specific circumstances, we generally obtain it as needed. We don't recommend blanket releases. We encourage and support conversations and exchange with parents, and truly, more often than not, we're in the phone, the parents are on the phone with us in the exam room. Students have called their parents, or as soon as we start talking about, needing to do some kind of medication or intervention, students want to talk to their parents about it. I think what's important is that you talk to your student about when you want to hear about things, when you want to know that they're coming to health services, when you want to know if something's being prescribed or if we're sending them to a specialist. At what point you want to have an agreement with them around when they're going to rope you into that conversation. We generally can call students. We can talk to parents about generalities. We would say, if we had a case of suspected mononucleosis, these are the kinds of tests we might do, and this is the kind of treatment we might recommend. We can have those kinds of conversations without confirming that we saw your student or actually did any of this until we get their release. We have not had this, really, I've not had problems with this. Students are pretty open about it. But again, you need to have those conversations. A second level of confidentiality comes up with a healthcare proxy or an emergent medical power of attorney. This is a legal document that most people keep on file. Some hospitals will require an original document. It only comes into play when an individual is unable to speak for their own health needs. So it's for dire circumstances. But an original signed document should be kept by the person assigned as the proxy, which is probably you, the parents. It should be kept with the legal provider in their office who helped you create that document, and with your student. We have electronic records here. We can always upload a copy of a document like that to our electronic records, but some hospitals will require an actual original document. So it's important to know where those are as well. So short of these dire circumstances, let's go on to the next slide. I want to give you some tips on preparing to meet your students' health needs while they're away at college. So the first thing I always recommend is that you really, sit down and actually have a conversation about your students' health. Do they have any known allergies? Do they have any known conditions? How do they treat when they get a cold? How do they take care of themselves? But in addition to that, looking in a broader way at, does your student know themselves? Are they the kind of person who needs 9 hours of sleep a night, who needs to eat food at regular times? How do they take care of themselves? Under what circumstances do they function best, and how are they going to sort of make a plan to help make that happen? One thing you can do is create a little personal first aid kit, thermometers, Band-Aids, some insect repellent, whatever over-the-counter medications your student understands how to use. Students who are taking prescription medications should keep them in a locked box in their room, maybe having a conversation about certain prescription medicines that other people may be interested for recreational purposes, and practice dialoguing, how you say no if somebody asks you for those are recommendations. Talk about your insurance coverage. At the health center, all visits will have an insurance claim sent unless a student tells us that they need it to be confidential. Any uncovered expenses are paid for you out of student fees. We at the health center won't send out a bill to you, but it's important for you to review your insurance coverage in Massachusetts. Massachusetts has regulations mandating that all students have coverage in the area that they're attending school. So check to make sure that you have local in-network specialty providers. Know if prior authorization is needed, if there's any laboratory or pharmacy access requirements. It's important for you to know that the school does broker a platinum level health plan that is a 1-year plan that is pretty comprehensive, and information on that plan is available online at University Health Plan website, which is posted on the website. So I hope that everybody stays well during the semester, and we don't have to see your students much, but if they do need supports, we are here to help them.
Thank you so much, Diana. We are now going to turn to Joy, who will talk with us about the Brandeis Counseling Center. Joy. Joy, I want to make sure you're unmuted.
I'm now unmuted, yes.
Perfect.
Thank you.
Okay. Thank you.
Dvora. I'm Joy von Steiger. I'm the director of the Counseling Center. Can we go to the first slide? So here at the Brandeis Counseling Center, we aim to facilitate student success in education and development, and to promote individual and community wellness within the university. So we identify as a multicultural treatment center committed to the values of multiculturalism, diversity, and inclusivity. We treat students of diverse backgrounds while utilizing a culturally sensitive lens and foster exploration of sociocultural identity. Furthermore, the center seeks to promote positive social change and deep appreciation for the strengths represented cross-culturally in our Brandeis communities. To that end, we have a number of folks here in the Counseling Center who speak various languages, as well as people who come from various parts of the world. So we have the capacity to make matches based on students' preferences for people of various backgrounds, and both socioculturally but also ethnically. Next slide. So here at the Counseling Center, we offer a variety of services. We're able to do an assessment. We're able to do consultation, emergency care. We have time-limited individual therapy. We have group therapy. We have psychopharmacological assessment and medication management. And we have referrals to outside resources. Students who are interested in our services contact us either by coming into the Counseling Center or by calling and speaking to our administrator. They set up an appointment for what's called a brief assessment, where they will meet with one of our therapists and talk about what it is that's on their mind, talk about if they're having symptoms that they're disturbed by, and what it is that they want help with. And the therapist will come up with a treatment plan, which could be individual therapy, it could be group therapy, or sometimes might be a referral to an outside provider. Next slide, please. So the treatment team talks to students about billing when discussing treatment planning. This is important because I think sometimes students are surprised when they're, maybe for the first time, in a situation where they're being engaged in a conversation about finances around their health care. Sometimes we want to be able to engage a student in a conversation about whether or not their health insurance will cover the treatment that we're recommending, both here within the center, or if we feel like we need to make a referral outside of the center. We'd like the student to be able to have that conversation with us about what their insurance might cover. Group therapy is offered free of charge. Individual therapy is billed to the student's insurance after a small number of sessions are offered free of charge. If your student has insurance through Brandeis, there is no copay, but we do bill insurance. We bill insurance for both Brandeis and non-Brandeis insurance. Psychopharmacological visits are billed from the very first visit, and students can fill out a fee request form to negotiate a reduced fee or free care. Next slide. So in terms of consent for treatment and confidentiality, students under the age of 18 need consent of their parents in order to have any kind of medical or psychiatric treatment. Our consent form is found on our website. So if your student is coming to the university and they're going to be arriving and will be under 18, it's not a bad idea to be talking to them about getting consent for treatment, both at the health center and at the counseling center. Parents for students who are under 18 can have access to their medical records, so it's important to have a conversation with your student about what the expectations are about their privacy. Students over the age of 18 do not need parental consent to be treated, and parents are not entitled to information about their treatment unless they sign a release of information. So again, it would be important to have a conversation with your student about whether or not you'd like to be involved in the treatment, and whether or not they'd like you to be involved in the treatment, in which case they would need to sign a release of information. If you're concerned about your student, you're always welcome to call the counseling center and talk to us, and you can share information with us. Even if there isn't a release of information, we're always eager to receive information about your concerned student. Next slide. So the BCC only sees students for psychiatric treatment, for psychopharmacology, who are in therapy. So our psychiatry services are just adjunct services to to psychotherapy services here at the Counseling Center. The BCC prescribes, psychiatrists prescribe medicine for ADD only if students have had neuropsychological testing within the last 5 years supporting a recommendation for medication. If students don't have recent testing, we can refer them to the Office of Accessibility and Student Support for testing. The BCC can help students find outside referrals for psychiatrists if they're only interested in medicine management. It's also important to know that home psychiatrists can prescribe medicines across state lines. So a number of students will maintain their relationships with their home psychiatrists. The important thing to know is that ADHD medicines, stimulants, are not allowed to be sent across state lines. The medicines themselves can be, so parents will sometimes fill the prescriptions at home and send the medications onto campus, mark them medication so that they're put in a special place. You can send them to, you can send them here and then mark medication, and they're kept in a safe place. If they are not stimulant medications, you can send other medications, but you could also use the service that that Diana mentioned through the health center, or use other local pharmacies. Next slide. Students with a history of emotional concerns, you ought to consider contacting us to let us know what your students' needs are before they come to campus. And what we'll do is we will open a chart for them and write down the important information that you share with us, so that if your student does come into the counseling center, we have a little bit of information to help us, to sort of guide us in the right direction from the very get-go, when we see them. You might also consider purchasing tuition insurance to reduce the loss should your student decide to take time off from Brandeis. If your student has a strong relationship with home providers, whether that be a therapist or a psychiatrist, consider maintaining those contacts through the college transition and beyond. We find that the transition to college is a very stressful time, and students who have very strong relationships with home providers often can really use those supports as they make that transition. And students are also going to be returning home during vacations over the summer. So having continued access to those treaters is often a really good idea. So we encourage that. So one of the things that we often ask parents to think about doing is going to a resource through the JED Foundation called Starting the Conversation: College and Your Mental Health. It's a great resource for parents and students about how to talk about taking care of your mental health and how to tell if you're starting to have difficulty. It's important to be able to notice any change in your child's typical behavior. So if you're noticing that they start calling you less, they're reporting weight gain or weight loss, they're reporting changes in their sleeping habits, they're starting to have trouble with their grades, they're looking like they're getting sped up, or they're slowing down. They're isolating themselves. They're not taking your calls. If you're noticing any of these changes in behavior, you can suggest to them that they come to the counseling center. You could call the counseling center directly for a consult, or if you're really concerned about your student, you can call the Dean of Students office and let them know that you have some real concerns that you'd like some immediate help with. And the Dean of Students office will help coordinate a plan for how to get the whole network of people to engage in a supportive plan for your student. Next slide, please.
Thank you so much, Joy. I want to give a couple of reminders while Sheila is unmuting herself and before she begins. I want to remind everyone and tell those of you who joined us a little bit late that you can submit questions during this webinar, so please go ahead and do that if you have questions. Also, we've received a number of questions about the recording, and I'll remind you that everyone who signed up for it is for this webinar is going to receive the recording with the slides, so you'll be able to go back and refer to this later or share it with other people in your family who may be interested. So Sheila, have we got you with us for the Office of Prevention Services?
Yes, thank you. I'm here.
Thank you. I will let you take over from here.
Okay, wonderful. Thanks so much, Dvora. Thank you all for your time today. I really appreciate it. So as Dvora said, I'm Sheila from the Office of Prevention Services. And my office actually has two components to it. There's the prevention services side of the office, which I'll be talking about our efforts on campus for education and training to prevent harm from happening. And we also have, as part of our office, a response side of the house. And so that's our Rape Crisis Center. And I'll be talking a little bit about that as we go forward as well. And I wanted to open with talking a little bit about consent. And the next slide shows you, thank you, Dvora, the definition from the Brandeis Code of Conduct, which is the code of conduct that we use for all of our students here at Brandeis, and there are copies that are given out to students during orientation, so your students will become aware of it, but it's also on the Brandeis website. And if you just type in rights and responsibilities, it comes right up. So with consent, that's really something that I think we can all agree it's important, whether we're talking about ordering a meal together or entering into a relationship, that it's important that we really understand where our partners are coming from and what their needs and boundaries are. So this definition is, of course, somewhat lengthy out of the code, but the important thing I think to underscore is just we want to be able to continue to develop a culture of consent at Brandeis where students feel that it's okay, not only okay, but important to really be asking people when they want to have any kind of, particularly any kind of contact of a sexual nature, and really making sure that they're very clearly communicating their needs and desires and really being open to hearing the response and respecting the boundaries of partners. And that goes, across the board. I have students who frequently come to my office for different events and programs, and over the years I've worked here, some students will say, can I give you a hug, or those kinds of things. So even that kind of contact, it's sort of low pressure, but an important opportunity for students to practice being able to communicate how they want to have contact with people, and for people to be able to say yes or no and have that yes or no respected freely. And to that end, the next slide will show you there's some videos that you may want to use. They're kind of a nice way. I like all of them, but of course I'm going to say the Brandeis students in our Rape Crisis Center did the second video that you'll see on the list on that slide. And it's an excellent video that they did, kind of doing a parallel process, talking about what consent looks like. And the C-Store is a convenience store on campus here in Usedom that students frequent. So the setting gives you a sense of the Brandeis culture, it gives you the sense of the students and the context in which they're talking together about the meaning of consent. And it can just be a really nice way to be able to have a conversation with your incoming student, for them to be able to think about what are their boundaries, what are their needs, how do they express those needs to others, and what do they feel that is important for them to be able to say or do when they feel that those boundaries are not always being heard. And then, of course, we would never expect students to be able to have to manage all of these different dynamics on their own. So on the next slide, you'll see there's a list of education and training. So in early August, your student will be receiving an invitation through Campus Clarity, which is an external vendor that we use currently to provide some online training looking at what is consent, how does it work at Brandeis, what's the culture around that, what are things that students should know about how to be supportive for themselves and also one another in order to prevent harm. And then actually during the on-campus orientation, there's a wonderful theater group called Speak About It that comes every year. So they'll be coming to do a performance that looks at issues of consent and healthy relationships and communication. And then there'll be a session with students from our office, kind of talking with the first year students about what they've learned and what they recommend and how they work together to support each other and building a culture where people feel safe and respected and making the choices that they want to make about their own bodies. And then the third part of that is that we do have ongoing education and training through the office, not just for first-year students, although they're certainly part of it, but for all of our students. And the focus that we use for that program is around bystander intervention, which of course is sort of a whole community response of thinking about what do we do when we see others, and particularly others that we're becoming friends with and getting to know and care about, in situations where they could be harmed. How do we keep our own safety in the forefront of our minds and also think about ways that we can be helpful to those who may be in situations that could escalate to harm, to prevent the harm from happening. So sometimes, as I said, sometimes harm does happen. And so on the next slide, you'll see there's a list of resources. One of the things that I think is really important in the approach that our office takes to our work, and I feel this is really beautifully shared across our division, so with both Joy's office and with Diana's, of really trying to support the students and making sure that they're empowered to make choices and decisions all along the way throughout the course of their experience at Brandeis. And when students experience incidents of harm, it's important for them to know that they have lots of different options for where they can get support, and that we find that students often who have had experiences of harm will want to be able to talk with someone confidentially before they make any decisions about whether or not they want to go through a process to report the harm that's happened. So the offices that are listed here are all people on campus that students could go and have conversations with, where there's no pressure to report, they don't need to make any decisions, and really working with these offices, they can feel empowered to make choices about what they want to do as next steps. And that those are choices that they can make. And then if they decide they do want to go forward, if they've experienced harm and they want to report that, the following slide has a list of some of the offices where the students could go. I think, Dvora, if you advance that, there we go, great, thank you. Yeah, on this list here, that these are offices where students could go to file reports. The Dean of Students office issues and manages our code of conduct, so rights and responsibilities, and so that's the sort of place that they speak from. Our university police is a deputized police force, and so they function as a law enforcement body. And then Title IX, which sometimes people get a little bit confused about the difference between a criminal process and an administrative process, but Title IX is our administrative process, and so students can go through that also if they have had an experience of harm and they want to be able to report it, and go through a process where there's a finding of responsibility and consequences are issued. So those would be the offices where students would typically go, and that's a wonderful group of folks led by our Title IX investigator, Rebecca Tiller. So those are resources that are available for students who need that reporting option. And then if you look on the next slide, I'll just say that if for further questions, myself and in my office on our Rape Crisis Center side, my colleague Julia Ricky is here. For students, we have our office is located in USDAN. It's USDAN. It's one of the main sort of student hubs on campus. And we have an office for the Office of Prevention Services that's shared by the Rape Crisis Center. And students are staffing that office Monday through Friday from noon to 5 p.m. And then we actually have a hotline that functions 24 hours a day, 7 days a week. And all of the contact information is listed on that URL below, brandeis.edu prevention services under resources. And if you go to brandeis.edu/Title IX, that's a hub, a central page that also gives information about the university's policies related to consent and issues regarding Title IX. So I encourage you to check those out and look with your student at those when you have a chance. Thank you.
Thank you so much, Sheila. This is terrific. Thanks to all three of you. Now we have a nice chunk of time to do questions and answers, and we've been receiving many, many questions. So I'm going to actually ask all of our panelists be sure to unmute yourselves, because Alexandra, my colleague, is going to be sharing some of the questions we've received, and they're for for each of you, there'll be questions. So before we go ahead to that, I just want to point out that the next slide, which again you'll have in the recording, has the contact information for each of the offices who have presented today. So let's go ahead, and Alexandra, you want to start asking our parents questions?
Yes, absolutely. So first question is for Diana regarding nutrition at Brandeis. This participant is asking specifically, what resources does your office provide to help students avoid the quote-unquote freshman 15 weight gain? Essentially, what tips and resources do you have for healthy eating during this college transition?
So Brandeis does fund a nutritionist, a medical nutritionist, sits at the health center, and people can make appointments with her directly. And that's a wonderful service for students who are struggling with how to eat on their own and manage their food on their own. Dining Services itself also has wonderful, wonderful resources listed on their website. And they've done I think they've really made some efforts to create a variety of options. I think for parents, really talking to your students around when do they function best and what helps fuel them. Because this is probably, for most people, this is the first time in their life where they haven't had somebody else putting a square meal in front of them to eat. So they are making all of these choices by themselves. So I recommend that you go through the Dining Services webpage, that you look, the health center also has a nutrition section on its webpage, and look at, what kinds of choices there are and how do you decide, when you're going to be eating healthy and when you're going to give yourself some treats, and what does it mean to eat a healthy meal? What does that mean to you and your child? And how can you help them make sure that they're able to do that while they're here? So at Health Services, we have brochures. We talk to, when people come in and it's an issue, we provide a little one-on-one counseling around basic nutrition and give them brochures. But you're our allies and colleagues in this process of helping people learn how to take care of themselves. So we definitely see you as partners in this.
Wonderful. Thank you so much, Diana. Similar vein, question for Joy about any programs and initiatives you offer through the Counseling Center aimed at coping skills, stress prevention, anxiety reduction, again, in this very different situation being in college and the transition from high school.
Yes, absolutely. So most of our, if not all of our clinicians have been trained to offer work around specific skills. So around stress management, around time management, around coping skills. If a student is in individual treatment, they can get some of that through the individual therapy. We also have a number of groups that address specifically issues around coping skills, anxiety, stress reduction. We have a meditation group that is held outside of our building. We also are going to start this year a trauma-informed yoga. And we also partner with other offices on campus to offer workshops in coping skills and stress management. We partner with Academic Services and the Department of Community Living.
Great, thank you so much, Joy. Question for you. Are bios available for the counselors? You mentioned the counselors get different types of training. What's the process for matching students with counselors?
So we do have bios for all of our clinicians on our website. And sometimes students and families will look at those bios before the students come in. And students will say, I saw so-and-so's bio and they look particularly interesting to me. And we do take that into account. But what we often are listening for when we meet with a student is whether or not they have particular symptoms that are going to be addressed by a particular set of skills that a particular therapist has. So the bios give you a little bit of that information, but that's mostly what we're interested in. Is if we have a student that's coming in that is dealing with panic, for instance, that we want to make sure that they will be assigned to work with one of our clinicians that has a lot of experience with panic. Yeah.
Thank you so much. This next question is for Sheila. So you mentioned a lot of the trainings available at orientation on prevention services, specifically for first years, and you also mentioned an online training. Is that a mandatory training? How does that work for Brandeis students?
Yeah, that's a great question. There's been some back and forth about that, and we just, at this point, it's not mandatory. We strongly encourage students to do the training because it is a good baseline introduction broadly to the topic, and then they can come to orientation with questions. And at the orientation session, there will be students from our office who are returning students who are really well trained, and they can answer questions that students have about how the things they saw or learned in the online training apply specifically in a Brandeis context.
Great, thanks so much.
Great. Diana, I have a question for you that we received earlier, which is, if a student has been receiving allergy shots at home, will the health center continue to administer those? And if not, then what happens?
Sure. We actually don't administer allergy shots at the health center. We kind of consider that more of the specialty services. They're usually done through allergist offices. So we are very lucky in that we have some allergy services locally that people can become patients of and have them done there. And there was another doctor's office that was able to do some of those shots. So basically, we have a list of resources in the community. Some are within walking distance, and some are a little somebody would need to transport to. So people can call us if that's something that's going on with them, and we can help set them up with some local resources.
As a related question for you about allergies is, if students have severe food allergies, for example, what accommodations are in place for a medical response to a severe allergic reaction should that occur?
Yeah, that's a good question. So we have our student ambulance team actually carries epinephrine on their they actually have a little ambulance that they can drive around campus on, and so they would likely be a first responder. We also have those resources here at the health center. I recommend that if somebody has anaphylactic allergies, that they talk to their roommates about it, that they make sure that their roommates understand what the symptoms of that might look like, so that if they're around, they could help them. And again, with close peer groups, they would want anybody around to be able to help them. But we do have structured emergency access that's pretty quick through the Brandeis emergency numbers.
Okay, so speaking about emergencies, for example, if a student gets sick over the weekend, has a virus or a fever, is the student expected to call the emergency number, wait till the health center opens on Monday? What happens when things happen over the weekend outside of business hours?
Yeah, so we're really lucky here at Brandeis, you know, and it depends on the severity of what's going on. If a student isn't sure how serious it is or just want some advice, they can call the on-call clinician, and we're there to help them kind of determine what's the next best step for you. We may, in talking to them and doing a little assessment, say that we really want somebody to lay eyes on them and assess them. We're lucky that we have 2 urgent care centers within close proximity of Brandeis, and they have hours on Saturdays and Sundays. They are outside providers, so you would need to bring your insurance card, and charges would apply according to your plan. You'd have to pay co-pays, etc. But we're lucky that we have these resources here. They're open till 9 o'clock at night. And for hours beyond that, the emergency rooms at the local hospital are open 24/7. But again, if you need help kind of determining if this is something that needs immediate assessment or something that we'll see you first thing in the morning when we open, you can call somebody for that kind of help. For transportation, if it's an emergency, it's likely that an ambulance will be called to transport somebody from campus to the emergency room. Sometimes public safety can take people if it's something that doesn't involve body fluids, or it's something where they're obviously very stable, but otherwise they can't take on those kinds of risks. Urgent care is very close by. So often public safety will bring people there. It's usually a lower level of care. So they can often transport people there. Or sometimes students can even walk there. There's one really within walking distance.
Dan, I was to ask you one more question about transportation. This is Dvora, and I personally get this question a lot, so it might be helpful to get out ahead of this. A lot of parents and families have questions about transportation to regular or routine care appointments off campus and whether the school provides that, etc. So could you address that, please? Diana?
Oh, sorry. People will have to, find some transportation for routine, regular appointments. Uber, Lyft, cabs. By the time students are older, they often have friends that have cars that can help them, or they may bring their own car to campus. If something's like a follow-up visit, somebody went to the emergency room and they need to do a follow-up visit, often we can support through public safety, somebody giving them a ride. It's not the role of public safety to be transportation for people, but they've been very good about, if we approve it, trying to provide that service for students so that they can get to a one-off appointment. But if somebody's doing, twice a week appointments off campus, it's a little trickier. I think there was another question about hospitals, and I'll touch on that really quickly too, that if somebody's transported in an emergency via ambulance, they do generally take them to the closest hospital, which is Newton Wellesley Hospital. It's part of the Partners Healthcare system. And we work with them very closely and have for many years. So we have pretty constructive relationships with them. If a student wants to go to a hospital somewhere else and it's not an emergency, then of course they'll have to provide their own transportation to get there, because an ambulance is sort of obligated to bring people within a certain area. And public safety also isn't available to bring people longer distances away.
Okay, fair enough. Thank you so much, Diana. This next question is for Joy. Can a student and/or their family meet in person with someone at the counseling center in advance of their first day of college? And if so, how would they arrange for that?
Absolutely. What they can do is they can call the counseling center's main number, which has been flashed on the screen a number of times, and ask to speak with either myself or the assistant director, who would be able to meet with the family and the student, or just the student, to talk about what their needs might be over the course of the year. It's actually a great plan, because we're able to do some planning at a time when there aren't a lot of students here, and there isn't a lot of pressure, and we can get people in pretty quickly. So it's a great idea. And even if you don't live close to campus and you want to just have a conference call, we can also do that.
Wonderful, thank you. Potentially related to that or not, we've been getting a few questions about tuition insurance, which you had mentioned, if a student decides to take a break from Brandeis. Where should parents go to get more information about this tuition insurance and if it would be a good fit for them? One of our participants specifically is wondering about if it's a good option for students known to have pre-existing psychological conditions, given that there are some stipulations. So where could they go for more information about that?
So what I would recommend is that they speak to their insurance broker about tuition insurance, and what generally is probably the best idea is if their student is currently in treatment, to talk to their treaters about whether or not they feel like it would be a reasonable thing to do. Oftentimes, if the student and the family feels like, this is a great idea to start school, but there's been some history of there being bumps in the road that have required some intensive treatment and maybe some time to really focus on treatment. And there's some possibility that could emerge as an issue over the course of their first year here. Then it seems like it's a good idea to build that in, and then that's not an issue when a student asks their family to think with them about taking a leave. Then finances don't end up entering as a big issue.
Okay, thank you so much. So this is a question for Sheila. What specific programs are in place, again, for prevention of rape and sexual assault? You mentioned the students and the peer support groups who are available on campus. Can you just talk about that a little bit more, about how you get students involved in that process?
Yeah, sure. So in our office, in addition to the professional staff, there are several student workers, and I work together with the students to do a train the trainer program where we identify, recruit, and train Brandeis student leaders to help to lead bystander training programs. This past year, the structure of it was that we partnered with the student union. So all student club leaders received training in bystander intervention and then could make arrangements after that training to have the student leaders provide similar trainings for their student club or organization. And because, as you can imagine, Brandeis students tend to be very active and really involved, that's been a really important way for us to be able to provide the education and training to a large number of undergraduate students. We've also worked separately with special populations. So for example, we do a special orientation for first-year student athletes, and they receive training there. We've partnered with our office that does a lot of work with our Gateway Scholars. So that's our international students who are here in the summer to start their program early. So we do special training for them. And then in the Rape Crisis Center, we also have a team of students that work with the professional staff there, and they provide a lot of education and training, again, often through partnerships with student clubs and organizations, through our Residence Life office, through the student union, through our athletics office, to be able to provide programs on an as-needed basis. So working with particular groups around questions about how to prevent sexual harm, how to address issues of sexual harassment that may have happened. And so those trainings are generally customized, although we do have some that are pretty standard that we do. We did a series, for example, this past year in all the first year residence halls. So showing the video on consent and working with students on having conversations on that. So it's a combination of students doing a lot of the leadership and presentation, but it's also all supported by professional staff, and I do the evaluation process and so on, so that students are hearing from their peers and they're also supported by the professional staff.
Excellent, thank you so much. This question is back for Diana. We're getting a lot of questions actually about health insurance, co-pays, in-network, out-of-network. How would be the best way to address that? And also a question about the insurance waiver and what the deadline is for waiving university insurance. So Diana, could you speak to generally how to find the answers to those questions?
Sure. So I want to reiterate that all students can access the health center regardless of their insurance and their coverage. We are in network for several insurers, but not all. Some require it, some don't. The important thing is that that we don't send out bills. Uncovered fees, co-pays, things like that for the health center will be covered out of student, are paid for by the school for you out of student fees. But it's important for you to know that if we had to send something out to a lab or need to refer somebody to a specialty provider or to urgent care, then they are going to be looking for insurance. So it's just important for you to know if your insurance has access to services in the area for providers. Everybody by state regulations has to report insurance to the state every year. So there's a couple of deadlines for that. One is the deadline upon which, if you haven't reported insurance, it will start to show up on your bill, the cost of the mandated insurance, if you haven't reported alternate insurance. And that's the earlier date. And then a second date is the end of the open enrollment period for signing on for that insurance. Information about that is available at universityhealthplans.com.
Great, thank you so much. Could you also tell me about getting blood work done? Is that a service that you offer? Several folks are asking if the health center has the ability to draw blood, test for mono and other things, and then send that off.
Yep, we are a local doctor's office on campus. So, our providers will write orders for labs that they believe are necessary. And if we're concerned about mono or strep or a fatigue or Lyme's disease or any of the numerous things that are conditions that we often see, we can draw and collect labs and send those off to for analysis at laboratories. The laboratory is an outside provider. They will charge for the cost of analyzing those tests, and that will be billed to your insurance. But we do lots of that. We don't have a pharmacy here at the health center, but we do administer some medications. Sometimes we'll get people started on an antibiotic while we're waiting for the pharmacy to deliver it later that afternoon. Sometimes we'll just give people a course of antibiotics if it's a short course of antibiotics. There are also 3 pharmacies that people can walk to within the neighborhood. So if somebody's insurance requires something specific, we're often able to just send that pharmacy down the road, send that prescription down the road to a local pharmacy.
Thank you so much. So we are running close to time here. We got a couple minutes left, so just want to ask 1 to 2 more questions. The first is, should students carry around their HIPAA and/or healthcare proxy forms, or is there somewhere where at Brandeis where these forms can be kept on file?
Right. So I had talked about that a little bit. That we do keep, whenever we get a consent or have to talk about a student's treatment records, we keep a record of that in their chart. These are electronic charts. A healthcare proxy should also be kept, an original copy should be kept with the person who is that healthcare proxy, so that they can produce it if needed. These are for dire circumstances, a healthcare proxy, and as well as with the legal office that helped write that up possibly, as well as with the student. But the students don't usually walk around with these in their pockets. They could have it in their room and in a dire circumstance, student life could get that for them. But the housing department would be able to get it. But again, these are pretty dire circumstances, so you certainly don't need to keep those in your back pocket. We do recommend that people carry their insurance card like you would carry any ID, because that's handy to have with you at times.
Sorry, Diana, I'm sorry. So you're, I want to ask you before you sign off for one more thing. And I'm going to ask each of our presenters, since we're wrapping up, to just share any last thoughts with our parents before we wrap up, or as our wrap up.
Sure.
So Dan, if you don't mind going ahead.
Yeah, thanks. Yeah, I mean, I think what I'd most like to communicate is that we are your doctor's office on campus, and we want to be accessible to our students, and we want to meet identified needs. And so if you're having any health concerns or any questions about health, your child's health, or how we can best help that, feel free to contact us, because that's why we're here. We're here to help your children be healthy. I feel like we're all on the same team, and our goals are your goals in terms of keeping your children healthy and well and helping them finish their school here. So I look forward to working with you all.
Great, thank you. Joy, any last thoughts for our participants?
Yeah, I just want to encourage families and students to to think about using us not only for routine treatment, but if there are emergencies, we have urgent care every day, Monday through Friday at 11 a.m. and 3 p.m. And we also have 24-hour consultation where you can speak with a clinician. And that number is on our website. We're available even if you're not a student here. You can have access to the urgent care hours and have access to the after-hour consultation. Both students and parents can have access to the after-hour consultation line.
Great, thank you. Sheila?
Yeah, I guess just to underscore that, I think each of us, on behalf of all of our staff here in our office, we take very seriously the responsibility and charge to care for your students while they're here with us. We're thrilled to work with students, and we've had just amazing students, both who come to seek our services, but also who work in our office as student staff and as volunteers. So it's a place that the physical space, obviously you can't see it right now, but it's a very welcoming space. So certainly for students, some students come, as I said, to see us because they've experienced harm, and many students come just because they're looking for a place to connect, because they care about these types of issues on campus and want to prevent harm for others, and they end up becoming volunteers in our office. They end up becoming part of our student staff. So if you have a Brandeis student who has a passion for these issues, please send them our way. And just thank you so much. Thank you for your time today.
Thank you. So just in summary, I do want to let you know that we do have more questions. We know more questions were submitted. We can't get to any more today. However, you will get these slides, and you will be able to contact the offices that presented today and the other resources that they referred to in the future going forward. You can also ask parent-to-parent questions on the Brandeis Parents and Families Facebook group, which is a great way of getting more experienced parents and to answer your questions about what their students have accessed and how things have been for them on campus. I want to thank all of you for being here with us, and I definitely want to thank our terrific panelists who spent a great deal of time thinking about how to best prepare you in this pilot first-time webinar that we're trying. So thank you to Diana, to Joy, to Sheila, and to Alexandra Stevens for helping with behind the scenes and with the question and answer period at the end. It's been a pleasure, and we look forward to seeing you for another webinar in the future. Take care.